All right, buckle up, everyone. We're going deep today, diving into the world of, well, your insides, specifically the lower GI tract. And get this, you guys sent us some excerpts all about nutrition therapy for lower GI issues.
Yeah, always a popular topic, right? I mean, who hasn't had a bout of digestive distress at some point? Makes you realize just how much, what we eat can really impact how we feel.
Totally. So before we get into specifics, maybe we should do a quick anatomy recap so everyone's on the same page. When we say lower GI tract, what exactly are the key players here?
Okay, picture it like this. You've got the small intestine, which is like the MVP of nutrient absorption, especially that first meter or so. It's incredible how much happens right there. Vitamins, minerals, all the good stuff. Then you move into the large intestine, and its role is more about water and electrolytes, keeping things balanced.
So small intestine, nutrient central. Large intestine, hydration station. Got it. But there are also those other organs, right? Liver, gallbladder, pancreas. The textbook calls them accessory organs, but they don't sound very accessory to me.
Oh, you're right. They're absolutely essential. Take the liver, for example. It's like the control center of metabolism, breaking down nutrients, making proteins, detoxifying all sorts of stuff. And then there's the pancreas, pumping out those crucial digestive enzymes that help us, actually break down food into usable pieces.
So we've got our digestive dream team all set. Now, let's talk about how diet plays a role in some common lower GI issues. The excerpts really focus on nutrition therapy. So let's start with a big one that I think a lot of people can relate to: constipation.
Constipation is definitely more than just an inconvenience, and it's actually defined by more than just infrequent bowel movements. It's also about consistency of the stool, difficulty passing, straining, that kind of thing.
And the excerpts actually list out risk factors beyond just low fiber, like certain medications or even, think of this, psychological stress. Really makes you think about how interconnected our bodies are, huh?
It does. And here's a little myth buster for you. You don't necessarily need a bowel movement every single day. As long as things are, moving comfortably and regularly for you, you're probably good.
Good to know. Okay, so let's talk fiber then. It's often touted as the solution for constipation, and the excerpts even have this whole section on a high-fiber diet. Give some practical swaps like brown rice instead of white rice.
Yeah.
But can you have too much fiber?
You definitely can. If you suddenly load up on fiber without gradually increasing it, you could end up with more gas, bloating, even diarrhea. It's all about finding the right balance for your gut.
And the excerpt recommends 25 to 38 grams of fiber daily, but that's for overall health, right?
Yeah.
Not specifically for optimal bowel function.
You got it. The amount of fiber needed for regular bowel movements, that can vary from person to person. And sometimes, especially if you're dealing with certain conditions, too much fiber can actually backfire.
Speaking of which, let's flip the script and talk about the other end of the spectrum. Diarrhea. I think a lot of people just see it as a temporary annoyance, but the excerpts emphasize it can actually be more serious than we think, especially because dehydration.
Yeah, dehydration is a big concern with diarrhea. And you're also losing electrolytes, which can be problematic too. The excerpts actually break down diarrhea into 3 types: osmotic, secretory, and antibiotic acquired. And they each have a different underlying mechanism, which is important because you really want to address the root cause of the diarrhea, not just the symptoms.
Okay, so break it down for us. What are the differences between these types of diarrhea?
So osmotic diarrhea, that happens when there are too many particles in your intestines. And those particles basically draw water in, like with lactose intolerance, for example, when your body's not digesting the sugar in milk properly. Then there's secretory diarrhea, where the intestines are basically pumping out too much fluid. That can be caused by, infections, certain GI diseases like Crohn's. And then lastly, you've got antibiotic-associated diarrhea. I think we've all experienced that fun side effect at some point. It's that, that disruption of the good bacteria in your gut.
So it's not just about treating the symptoms. It's about figuring out what's causing the diarrhea in the first place.
Yeah.
And the excerpts get surprisingly specific about what to eat and what to avoid when you have diarrhea.
Oh, yeah. Like, for example, those sugary, clear liquids that people often turn to, those can actually worsen osmotic diarrhea because of all the sugar that basically, add to the particle problem we talked about. And avoiding things like caffeine, alcohol, high-fiber foods, even those sugar alcohols lurking in diet products, that can all be helpful, at least temporarily.
It seems kind of counterintuitive to avoid fiber when you have diarrhea. But I guess it's about giving your gut a chance to rest and recover.
Exactly. Speaking of gut recovery, the excerpt also mentions probiotics, those live bacteria that can help restore a healthy gut microbiome.
Probiotics are so trendy right now. Any thoughts on that?
Yeah, it's a super interesting area of research, but it's still evolving. The excerpt suggests focusing on getting probiotics from food sources rather than supplements for now.
So like yogurt with live cultures rather than popping a pill.
Exactly. Now, before we move on to more specific conditions, let's talk about malabsorption disorders in general. That's basically when your body isn't absorbing nutrients properly, right? Yeah, good summary. But it's important to distinguish between two types. Sometimes the problem is with digestion itself, and it usually affects just specific nutrients. Other times, it's an issue with the absorptive surface of the intestines, and that can lead to more widespread malabsorption.
And the excerpt lists out some pretty alarming general characteristics of malabsorption, like weight loss, pain, oily stools, even metabolic problems like bone pain from vitamin D deficiency.
Yeah, it really shows how critical nutrient absorption is for our overall health. And that's why nutrition therapy for malabsorption is so important. It's about managing those symptoms, replenishing the missing nutrients to prevent further complications.
Okay, I'm starting to see the bigger picture here. It makes me think about a specific type of malabsorption that a lot of people deal with, lactose intolerance.
Perfect example. But let's clarify a common misconception. Lactose intolerance is about having symptoms after consuming lactose. Lactose malabsorption is the actual impaired digestion of it.
So you could have the malabsorption without the intolerance, meaning you might not even notice anything's wrong, even though your body isn't digesting the lactose properly.
Exactly. And here's a mind-blowing stat from the excerpt. Lactose intolerance affects something like 68% of the world's population.
Wow. I had no idea it was that common. It's practically a global phenomenon.
It is. And here's another twist. Adults who can easily digest lactose, like people in those Nordic countries, they're actually the exception, not the rule.
Really makes you think, huh? So for most of the world, ditching dairy seems like the obvious answer. But the excerpt actually has a low-lactose diet section that lays out some pretty interesting details.
It's not always about complete avoidance. Some people can tolerate up to 12 grams of lactose, which is about a cup of milk, especially if they, have it with food. And here's a curious one. Chocolate milk might be easier to digest than plain milk.
Wait, really? Is there any idea why that is?
The research is still kind of unclear on that one, which I find fascinating, shows how much we're still learning about, digestion and individual responses. But the important thing to know is that lactose can be hidden in all sorts of processed foods. So learning to read those labels carefully, that's key.
I'm noticing a theme here. Label reading is crucial.
It's a good skill to have for anyone who, wants to really understand what they're eating, especially if you're managing specific dietary needs.
Okay, so we've covered constipation, diarrhea, malabsorption, lactose intolerance. I'm starting to think gut health is maybe more complex than we give it credit for.
Oh, it's a super intricate system, for sure. And we're just scratching the surface. But this is a good foundation as we move on to some more specific conditions like inflammatory bowel disease.
Great. I'm ready to dive deeper.
Okay, so now that we've got some of the basics down, let's dive into a few specific conditions that can, really wreak havoc on the lower GI tract. You sent over some excerpts on inflammatory bowel disease, or IBD, which is actually a broader term that covers a few different chronic inflammatory conditions.
IBD. Yeah, I've definitely heard the term, but I'm a little fuzzy on the details. What exactly is IBD?
Basically, it's all about chronic inflammation in the digestive tract, but there are different types. The excerpts focus on two of the most common, Crohn's disease and ulcerative colitis.
Okay, so what's the difference? They both sound pretty intense.
Oh, they can be. Both can really, impact someone's quality of life. The main difference is where the inflammation is and how it presents. So Crohn's disease can actually affect any part of the GI tract, from mouth to anus. And the inflammation can be like patchy, affecting different layers of the intestinal wall. Ulcerative colitis, on the other hand, that's limited to the colon. And the inflammation is continuous, affecting just the innermost lining.
So different locations, different patterns of inflammation. But both involve this chronic inflammation. What causes that?
Well, that's the million-dollar question, isn't it? The exact cause is still unknown. But the excerpts point to, a combination of factors, including genetics, a bit of an overzealous immune system, even environmental triggers.
Makes me think about how IBD is becoming more and more common in Western countries. Suggests maybe lifestyle plays a role. The excerpt mentions things like smoking, diet, even antibiotic use as potential contributors.
Right. It really highlights how, lifestyle choices can make a difference. There's actually some exciting research suggesting that a diet high in fruits and veggies, omega-3s, and vitamin D might actually have a protective effect against IBD. Still lots to learn, but it's promising.
I'm definitely taking notes. Okay, so let's talk about managing IBD then. The excerpt differentiates between managing active disease, so like during flare-ups, versus maintaining remission when things are relatively calm.
Right. It's an important distinction because the dietary strategies can change depending on whether you're trying to, just get symptoms under control during a flare or really support long-term healing and gut health.
So what does nutrition therapy look like during those active flare-ups?
Well, the main goals are to, control the symptoms, promote healing, and really minimize any stimulation of the gut. So a low-fiber diet is often recommended during flares just to kind of give the intestines a break.
Makes sense. But I was surprised to learn that calorie needs aren't actually higher just because of the IBD itself.
It's true. The problem is that a lot of people with IBD, they struggle with weight loss, because of malabsorption or maybe just not feeling up to eating during a flare. So increasing calorie intake, that's often necessary to support recovery and prevent further weight loss.
It's all about, replenishing those lost nutrients, giving your body the fuel it needs to heal.
Exactly. And in some really severe cases, the excerpt even mentions using enteral nutrition, basically tube feeding. That's if someone just can't get enough calories and nutrients through their diet alone.
Wow, that's serious stuff. Really highlights how much of an impact IBD can have on someone's their nutritional status.
For sure. But the good news is, during remission, dietary restrictions can often be relaxed a bit. It's all about finding that balance and working with a healthcare provider to, identify individual triggers and create a personalized plan.
So it's not a one-size-fits-all approach, even within the same condition.
Exactly. Okay, switching gears a bit, you also sent over some info on celiac disease. It often gets lumped in with IBD, but it's actually completely different.
I was wondering about that. I know celiac disease has to do with gluten, but I wasn't sure how it differs from IBD.
So with IBD, we're talking about inflammatory conditions, but celiac disease, that's an autoimmune disorder, specifically triggered by gluten, a protein found in, wheat, barley, and rye.
So it's your own immune system attacking the small intestine in response to gluten. And I remember the excerpt saying it's not just a childhood disease either, right? More adults are being diagnosed these days.
You're right. And the symptoms, they can be all over the map, which makes it tricky. Some people get the classic digestive issues, but others have like extraintestinal symptoms, things like anemia, bone problems, even skin rashes. And some people have no noticeable symptoms at all.
Wow, that makes diagnosis tough.
It does. But the key point is that gluten is causing damage to the small intestine, which can lead to all sorts of complications down the road. And unlike IBD, where there's no single cure, celiac disease has a very specific treatment, a strict gluten-free diet.
Right. That's where all those gluten-free products come in. Gotta admit, it's gotten pretty trendy these days. But for people with celiac disease, it's not a choice. It's a necessity.
Absolutely. And it requires a lot of vigilance because gluten hides in the most unexpected places. The FDA has labeling guidelines, but you still got to read those labels carefully and be aware of, potential cross-contamination.
I'm having flashbacks to our lactose conversation. It's amazing how these seemingly minor ingredients can make such a huge difference for some people.
It really is. And it speaks to the power of food and how important it is to understand what works for your body. Speaking of individual needs, let's move on to a condition that results from a very specific situation, short bowel syndrome or SBS.
SBS. That's a new one for me.
Right.
What is that all about?
As the name suggests, it involves having a shorter than normal small intestine, usually because of surgery where a portion was removed. And this can create some major challenges with nutrient absorption, leading to what's called intestinal failure.
Wow, that sounds pretty intense. Is it a common condition?
It is the leading cause of intestinal failure. And the excerpts actually outline 3 types of SBS, jejunostomy, jejunogonastomosis, and jejunal anastomosis. It all depends on which parts of the small intestine are removed or bypassed.
So different types based on the surgery. But why does it matter which part is removed? I thought the whole small intestine was involved in nutrient absorption.
It is, but different sections have, their specialties. Losing part of the ileum, for instance, that's particularly problematic.
The ileum, what makes that section so crucial?
Well, that's where vitamin B12 and bile salts get absorbed. And without those, you can run into some serious issues.
So if someone has SBS, how do they get the nutrients they need?
Well, nutrition therapy really focuses on promoting something called intestinal adaptation. It's basically helping the remaining part of the gut get better at absorbing what's left.
It's amazing how adaptable the body can be.
It is. The process often starts with parenteral nutrition, so that's delivering nutrients directly into the bloodstream. Then enteral nutrition, which is tube feeding, gets gradually introduced. And as the gut adapts, oral intake can slowly be increased.
So it's a gradual process, starting by completely bypassing the gut and then slowly working back to normal eating.
Exactly. And the excerpt outlines some key dietary strategies to support that whole adaptation process.
Tell me more. What kind of diet is recommended?
Think small, frequent meals so you don't overload the shortened gut. Avoiding simple sugars and those sugar alcohols is key because they can make diarrhea worse, which is a common issue with SBS. Chewing food thoroughly, that helps too. And depending on the type of SBS, you might also need to limit fat intake.
It's all about supporting the gut and, giving it the best chance to adapt.
Precisely. Okay, now let's shift gears to a condition that's, incredibly common, but often misunderstood and even misdiagnosed. Irritable bowel syndrome, or IBS.
Yes, IBS. Seems like everyone knows someone who has it. What are the key things to know about IBS?
Well, first off, it's one of the most common GI diagnoses out there, but there's no single clear-cut cause. It's characterized by abdominal pain, along with changes in bowel habits, could be diarrhea, constipation, or even a lovely combo of both. Bloating is also a frequent complaint.
Sounds pretty miserable.
Yeah.
And you mentioned earlier how stress can be a trigger, but it's not the whole story, right?
Nope. Stress can definitely make things worse, especially if you're already prone to IBS. But there's more to it.
So if it's not just stress, what else is going on? What do the excerpts say?
The research suggests it's this complex mix of factors, things like disruptions in that gut-brain connection, that communication highway between your brain and your gut. There can also be problems with gut motility, so, how fast or slow things move through. And then there's visceral hypersensitivity, where you basically feel pain more intensely in your gut. Oh, and we can't forget the gut microbiome. Changes in that bacterial balance can contribute to symptoms, too.
Wow. It really is multifaceted. And the excerpt actually points out that over 80% of people with IBS report food-related symptoms.
That's huge. It really underscores how much potential there is for, dietary interventions to help manage IBS. And this is where FODMAPs come into play.
FODMPs, that acronym popped up in the excerpts. Can you remind me what it stands for and why these FODMAPs are such a problem for people with IBS?
Okay, so FODMAPs stands for fermentable oligo, di, and monosaccharides and polyols. It's a mouthful, I know. But basically, we're talking about carbs that are poorly absorbed in the small intestine.
So they kind of skip the absorption step and head straight for the party in the large intestine.
You got it. And when they get to the large intestine, they're fermented by bacteria, which can trigger all those unpleasant IBS symptoms, gas, bloating, pain, changes in bowel habits, the whole shebang.
Okay, so the low FODMAP diet is all about reducing those fermentable carbs. What kinds of foods are we talking about here?
Some of the usual suspects are fruits like apples, pears, mangoes, veggies like onions, garlic, broccoli, dairy products with lactose, wheat, and some sweeteners like honey and high fructose corn syrup.
That sounds pretty restrictive. Can people actually follow this diet long term?
It does require some serious commitment and planning. But the good news is studies show that even long term, a low effort eating diet can be nutritionally sound and well tolerated.
Well, that's good to hear. So it's not about deprivation. It's about, finding that right balance and figuring out your individual triggers. And I remember the excerpt mentioning a two-phase approach to the low FODMAP diet.
Right. It starts with an elimination phase where you avoid all high FODMAP foods for like 4 to 6 weeks to see if your symptoms improve. And if they do, then you move on to the reintroduction phase. That's where you gradually add back individual FODMAPs to pinpoint which ones are your specific triggers.
So it's like a detective game for your gut. Really highlights the importance of working with, a knowledgeable dietitian who can guide you through that whole process.
Absolutely. Having that personalized support is so valuable, especially for something as tricky as IBS.
Okay, so we've tackled IBD and celiac disease, and now we've got a good handle on IBS. Feel like we're making good progress in our lower GI tract journey. What do you say we take a little detour now and explore those accessory organs we mentioned earlier?
Sounds good to me. We've already talked about how important they are for, overall digestion, but they can also have their own unique set of challenges.
I'm game. Let's start with the liver, since it's such a major player in the body. What happens when things go wrong there?
Well, we're talking about liver disease, which is a whole spectrum ranging from fatty liver to hepatitis to cirrhosis. And here's a sobering stat. NAFLD, non-alcoholic fatty liver disease, is now the most common cause of chronic liver disease.
Wow, I had no idea it was that prevalent. What causes it?
It's often linked to obesity and metabolic syndrome, which, really underscores how important it is to maintain a healthy weight and lifestyle.
So what does nutrition therapy look like for an AFLAD?
Weight loss is key, and a Mediterranean-style diet is often recommended. And here's a surprising one. Coffee actually seems to have a protective effect.
Wait, coffee is good for the liver?
Well, there are no liver-related restrictions on coffee for people with NAFLD. It might seem counterintuitive, but, that's what the research is suggesting.
Okay, I'm definitely intrigued. Let's move on to the pancreas. What happens when things go wrong with that digestive powerhouse?
Well, the pancreas is all about those digestive enzymes and insulin. And when it gets inflamed, we're talking pancreatitis.
And that can be either acute or chronic?
Yep. Acute pancreatitis can be pretty serious, often triggered by things like, alcohol, gallstones, or high triglycerides.
So what's the nutritional approach for acute pancreatitis?
Early enteral feeding is crucial for severe cases. For milder cases, people are encouraged to, start eating an oral diet as soon as they can tolerate it.
Makes sense. What about chronic pancreatitis?
Pancreatic enzyme replacement is often needed to help with digestion, and dietary recommendations vary a lot depending on, individual needs and tolerance. Low-fat diets are common, but it's really important to make sure people are getting enough calories and protein.
So much to consider. And let's wrap up our accessory organ tour with the gallbladder. What are the main things to know about gallbladder disease?
The gallbladder's main job is storing and concentrating bile. And when things go awry, you can get gallstones.
Which often leads to gallbladder removal, right?
Yep. It's one of the most common surgical procedures out there. But here's an interesting tidbit. Low-fat diets for gallstones, they aren't actually evidence-based.
Really? So what is recommended after gallbladder removal?
There aren't any hard and fast rules, really. It's more about, gradually increasing fiber, maybe trying probiotics if you have diarrhea, and really just listening to your body and figuring out what works best for you.
So this whole deep dive has been a real eye-opener. We've covered so much, from the basic anatomy to all these complex conditions and how to manage them through diet. What's one takeaway that's really sticking with you?
For me, it's just this reminder that nutrition therapy is so individualized. There are general guidelines, sure, but finding what works best for each person, that often involves some trial and error, careful observation, and a really good relationship with healthcare providers.
Absolutely. It's like a reminder that we're all unique and our bodies have, their own individual needs and responses. Mm-hmm. It's been great exploring all this with you.
Likewise. Keep those questions coming and keep diving deeper into that amazing world of your own body.
And all our listeners out there, thanks for joining us on this deep dive. Remember, knowledge is power, especially when it comes to your health. Stay curious. Okay, so we've talked about a lot of specific conditions already, but there's one more big one we need to address: Irritable Bowel Syndrome, or IBS for short. It's one of those conditions that I think gets misunderstood a lot, and it can be kind of mysterious too.
Yeah, you're right. IBS often gets dismissed as, it's just stress. But it's way more complex than that. It's what we call a functional disorder, meaning there's no visible damage or inflammation in the gut. But the symptoms, those are very real and can have a big impact on people's lives.
So let's talk about those symptoms. What are we actually talking about when we say IBS?
Well, the hallmarks are abdominal pain, along with changes in bowel habits. Right. So you might have diarrhea, constipation, or both. Sometimes people even swing back and forth between the two. And then there's bloating, that feeling of, fullness or pressure in your abdomen. Those are all common complaints.
Sounds super frustrating to deal with. And I know you mentioned stress is a potential trigger, but it's not the only factor, right?
Right. Stress can definitely make symptoms worse, especially if you're, predisposed to IBS. But there's a whole web of things at play. The research points to like disruptions in the gut-brain connection, that communication pathway between your brain and your gut. There can be issues with gut motility, how fast or slow things move through. And then there's visceral hypersensitivity, which is basically where you feel pain more intensely in the gut. Oh, and we can't forget the gut microbiome. Those trillions of bacteria living in your gut, changes in their balance can also play a role.
Wow, it really is like a multifaceted condition.
Yeah.
And the excerpt actually highlights how common food-related symptoms are with IBS. Something like 80% of people with IBS report those.
Yeah, that's a huge percentage. It really shows how powerful, dietary changes can be in managing IBS. And that brings us to the low FODMAP diet, which has become a pretty key strategy for a lot of people.
FODMAPs. Those tricky carbs keep coming up. Can you remind me what exactly they are and why they cause so much trouble for people with IBS?
So FODMAPs stands for fermentable oligo, di, and monosaccharides and polyols. It's a mouthful, I know. But basically, it's a group of carbs that are poorly absorbed in the small intestine.
So they basically bypass the absorption step and head straight for the party in the large intestine.
That's a good way to put it. And once they get to the large intestine, they're fermented by bacteria, which can lead to, all those fun IBS symptoms: gas, bloating, pain, changes in bowel habits, the whole 9 yards.
Okay, so the low FODMAP diet is all about minimizing those fermentable carbs. What kinds of foods are we talking about specifically?
Some of the common culprits are fruits like apples, pears, mangoes, veggies like onions, garlic, broccoli, dairy with lactose, wheat, and some sweeteners like honey and high fructose corn syrup.
Sounds pretty restrictive. Is it realistic for people to follow this diet long term?
It definitely requires some, planning and commitment, but the research is pretty encouraging. It suggests that even long term, a low FODMAP diet can be nutritionally complete and, people tolerate it pretty well.
That's good to know. So it's not about deprivation. It's about finding what works for your body. And I remember the excerpt talked about a two-phase approach to the low FODMAP diet. Can you explain that a bit more?
Sure. The first phase is elimination, where you cut out all high FODMAP foods for a period of, say, 4 to 6 weeks. The goal is to see if your symptoms improve. If that do, then you move on to the reintroduction phase, where you slowly start adding back individual FODMAPs to figure out which ones are, your specific triggers.
So it's like a detective game for your gut. It really emphasizes how important it is to work with a dietitian or someone knowledgeable who can, guide you through that whole process.
Couldn't agree more. Having that personalized support can make a world of difference, especially for something as tricky as IBS.
Well, I'd say we've covered a lot of ground today, from basic digestion to all sorts of lower GI conditions and how to manage them through diet. I feel like I've learned so much. What's one key takeaway that you hope listeners will walk away with?
For me, it's that gut health is so interconnected with our overall health. And while there are general guidelines, finding what works best for you often takes, some trial and error, paying attention to your body, and a good relationship with your healthcare team.
I love that. It's a good reminder that, we're all unique and our bodies have their own needs and responses. It's been great chatting with you about all this.
The pleasure was all mine. Keep those questions coming, folks, and keep exploring the amazing world of your own body.
And to all our listeners out there, thanks for joining us on this deep dive. Remember, knowledge is power, especially when it comes to your health. Stay curious.